Pregnancy is a wonderful journey, marking a big turning point in a woman's life. The joy of welcoming a little life into the world is unmatched. But sometimes, life doesn't always go as planned. There are cases where expectant mothers face the risk of miscarriage, a heartbreaking reality that no one wants. It's important for every mother to equip herself with knowledge about the early signs of miscarriage so she can recognize them and take action promptly. Here are 5 signs of miscarriage that expectant mothers need to be very aware of. The most common sign of a miscarriage is unusual vaginal bleeding. The blood flow can be bright red, heavy, or contain blood clots. During the first 3 months of pregnancy, any unusual vaginal bleeding should be carefully monitored. However, bleeding doesn't always mean you're having a miscarriage. There can be many other causes for this, such as hormonal changes, cervical polyps, or other minor issues. However, to be safe, you should contact your doctor immediately or go to the nearest medical facility for a checkup and consultation. During pregnancy, it's normal for expectant mothers to experience mild abdominal pain. However, if you feel severe pain in your lower abdomen, the pain is persistent and shows no signs of subsiding, pay special attention. The pain from a miscarriage usually comes in waves, cramping, and can be more painful than regular period cramps. If you experience this, you should see a doctor immediately for a proper diagnosis and prompt treatment. Unusual vaginal discharge is one of the warning signs of early miscarriage that expectant mothers need to pay special attention to. An unusual amount of vaginal discharge, with a strange color such as light pink, brown, or mixed with blood clots, can be a sign that the amniotic sac is detaching. In addition, if the vaginal discharge has an unpleasant odor, accompanied by itching, burning, or pain, it is very likely that you have a gynecological infection. See your doctor immediately for a checkup and prompt treatment to avoid affecting the health of both mother and baby. Pregnancy symptoms like morning sickness, breast tenderness, fatigue usually appear in the first trimester. However, if these symptoms suddenly disappear, you need to be very careful. This could be a sign that the fetus has stopped developing. Although the disappearance of pregnancy symptoms is not always a bad sign, to be safe, you should see your doctor for a checkup and monitoring. And dizziness and fainting are common symptoms during pregnancy, especially in the first 3 months due to hormonal changes. However, if you often feel dizzy, lightheaded, or even faint, see your doctor immediately. This could be a sign that you have low blood pressure, anemia, or more seriously, a sign of internal bleeding. A timely checkup will help you control your health condition and take appropriate action. So, we've learned about 5 signs of miscarriage that expectant mothers need to be very aware of. Again, it's important to emphasize that having these signs doesn't always mean you're having a miscarriage. However, to ensure the safety of both mother and baby, you should see your doctor as soon as you have any unusual signs. Early detection of health problems will help you take timely action, protecting your health and that of your fetus. If this video was helpful, please like and share it with your friends and family. Don't forget to subscribe to the channel to see more helpful videos about maternal and child health.